This is the 5th video in our 9-part educational series on His Choice Vasectomy. This video explains the 2 most common risks of vasectomy: vasectomy regret and bleeding. Vasectomy is a simple procedure. It accomplishes one thing: permanently prevents pregnancy. It is uncommon to have a long-term problem as a result of a vasectomy complication. Although vasectomy is extremely safe, no medical or surgical intervention is without risk. Regret may be the most common risk of vasectomy, and this is the risk that is often talked about the least. If you have a vasectomy while your partner is pregnant and she loses that pregnancy, either from a very early miscarriage or, God forbid, a late pregnancy stillbirth, birth accident, or within the first several months of life, then you will eventually regret your vasectomy. Women develop strong emotional attachments to pregnancy from the time of their missed period, and a loss can be profound. Even if you don't regret a pregnancy loss after your vasectomy, then your partner will, which eventually means you will too. Trust us, we know. We recommend you wait until after the birth of your child before having your vasectomy. If you have your vasectomy while you are being tortured in a troubled relationship, you have a higher risk of regretting your vasectomy in the future. If you have your vasectomy immediately before or after a divorce, you will have a higher risk of regretting your vasectomy in the future. Understanding the risk of regret starts with acknowledging none of us can predict the future. You could simply change your mind and want more children. You could become divorced, or your partner or child could die. No one plans or predicts these events. If you regret your vasectomy, then you will consider vasectomy reversal. Vasectomy should be considered permanent, but that does not mean vasectomy is permanent. Vasectomy can be reversed, but no one should get a vasectomy with the intent of reversing it in the future. 2 problems with vasectomy reversal are it may not work and it's expensive. The success of reversing vasectomy is dependent on how long you've had a vasectomy. As time passes after your vasectomy, the epididymal sperm factory begins to produce less and less sperm and can eventually shut down. Vasectomy reversal success is highest the first 3 years after a vasectomy procedure. But even if you were to reverse your vasectomy within days of having your procedure, there is not a 100% chance it will be successful. Vasectomy reversal is expensive. Insurance will pay for your vasectomy, but will never pay for your reversal. Vasectomy reversal will cost 10 to 20 times more than vasectomy, and this is a big reason why many men will not have a reversal procedure. It is common to have a small amount of bleeding after vasectomy. Often this is noticed as a few spots of blood on the gauze within hours of your procedure. It is even possible to have bruising within the scrotal skin that could last for several days. The chance of having a bleeding complication after vasectomy is about 1 out of 100. His Choice Vasectomy has a lower risk of bleeding than conventional scalpel vasectomy. Bleeding enough to be classified as a complication is usually referred to as a hematoma or internal blood clot. This is bleeding of an amount large enough to form a noticeable blood clot in the scrotum. Usually this will occur within the first 24 hours of the vasectomy. In most cases, the blood clot will be about the size of a golf ball and persist for several weeks. This complication can be uncomfortable, but most hematomas will be slowly absorbed. No treatment will be required, and they will not cause any long-term complications. Most men will not have a bleeding complication, and if they do have a bleeding complication, most men will not need any additional medical intervention. Infection is rare with His Choice Vasectomy. In fact, the risk of infection is so rare that routine antibiotics are not recommended after this procedure. It is very common to feel a small nodule at each vasectomy site. It is most commonly about the size of a pea, and this is where each vas deferens was divided. In the first several weeks after having a vasectomy, the vasectomy sites can be tender, but this tenderness often goes away. About 1 out of 200 men can develop a painful nodule at the vasectomy site that can persist for 6 months or more. Medications may help, but if the nodule is not responsive to medications, then a second office procedure to remove the nodule may be required. The 6th video in this series will discuss the 2 main complications that often cause the most concern among men considering vasectomy: failure and pain. Although these are often the most feared complications, vasectomy failure and pain are thankfully the least common.